All right, welcome everybody. We're here with this is the sixth Clubhouse chat here we're on now. Today's topic is going to be we're going to be talking about the bench press as it relates to shoulder. Welcome everybody coming on. Nice to see you, Kara, and Lydia is on here too. Lydia's a student with me, so Lydia can say hi if she wants to. She's kind of chilling outside for lunch, it looks like right now, but. We're going to be talking about bench press with the shoulder, so this one's for any meatheads out there like Eric, but it also pertains a lot to shoulder health for a lot of different people too. So we'll get some general population implications for this as well too. So what's up, Eric? How you doing?
I'm good. I'm so excited. There's nothing more functional in life than bench pressing, so this is going to be a good talk.
Yeah, I figured you like this one. So, I mean, common complaint, people who do a lot of bench pressing, working out, things like that, anterior shoulder pain, coracoid process, somewhere around, that point where people start describing a lot of pain, especially as they start pushing some volume. Someone who may be new to the gym, kind of experiencing some of the same things too. One of the first things I'm always looking at, especially if someone's new to the gym, but even experienced lifters too, is just kind of bar path. With bench press. Normally you think about people having a little bit more struggles with barbell as opposed to dumbbell. But with the bar path as it relates to the bench press, that's something I'm always looking at because a lot of people, when they push the bar, kind of where they place their elbows, bar going up and down, just the direct path that it may take towards the chest and then pushing back up over top of the chin or the face. Depending on if they're able to kind of keep a correct bar path, it puts a little bit more or less stress to the shoulder, could cause the shoulder to have to go into more extension as you drop the bar down to the chest. So there's just some different things there. I'll get more in depth to that too. But just kind of starting off, Eric, what are your thoughts on some of those things?
Yeah, I definitely think, like, especially for your less experienced lifter, it's going to be like anything else in life. Ask somebody who doesn't shoot a lot of free throws to shoot a free throw, and it's going to look like the most uncoordinated thing on earth. So if somebody just starts bench pressing, a lot of times their bar path wobbles a lot. You can just see like they're not steady. So a lot of times if they have pain, you may take a little bit of a different approach at it than an experienced lifter. And it's like that with any lift really, whether it's squat or bench press. So determining like how long have they been lifting, what's their training life, if it looks like it's just real shaky, do they just need more stability? Is that my first kind of go-to or take on it? Or do they have good form? Are they an experienced lifter and they need a different assessment as far as mobility?
Right. There's some obvious things to kind of get into with the shoulder, but with the barbell, and I know you've competed in powerlifting, Eric. So, I mean, is there anything that they're teaching you specifically there with the barbell is how you perform the press? To kind of more advantageously place the shoulder in a better position, or something that may be healthier?
So the biggest thing is when you press, I don't know how to show this without actually showing it. When you press, the bar should come towards the chest and it should actually go inferior. So more towards like lower chest. And then when you press up, you should actually be going up, but then also back towards the rack. And then, yeah, that's, I would say, one of the biggest things. Yeah. As far as bar path in particular.
Yeah, so that's what I've been told too. So just kind of wanted to hear what your learning experience was behind it as well. But if you think about that anatomically, kind of what's happening at the shoulder there. So when you in kind of lever arms, as far as placement of stress to the shoulder. So probably the side's the easiest place to show this, but so when you bring it down towards your chest and just you're kind of going inferior to the sternum is what they were telling you. Is that what you would say? Yeah. Yep. When you're coming down here, you obviously don't want to turn it into a skull crusher or a tricep. So I mean, if someone kept it up higher, the more the tricep's going to have to kind of work in that position. So taking it down lower allows you to kind of open the chest up, be a little bit more retracted, allow for the shoulders to kind of come back into extension. But why they tell you to push it up back towards the rack is purpose of it. If you kept it down here, there's always going to be, if you can imagine me laying on a bench, the weight of the barbell is going to kind of be putting down a little bit more. Whereas if you push back over top of your face, the gravity is going to push the arm straight back. So it's a little bit easier to just kind of hold that position there. So that's a cue that I tell a lot of people is, like what you said, pushing it back towards the rack works well. But then also just, push the barbell over top of your face is a nice cue for someone who's kind of trying to learn that barbell movement there. Something else too, and this is just kind of going off the top with someone who's just learning the movement. I'll usually start someone with dumbbells before I go to a barbell, just kind of my personal preference, but this is just general population. Someone who feels shaky and the instability with that too. I just had a client here actually this week who's dealing with this, is relatively new to the gym that I'm at, less than 2 weeks into the program, getting some lateral epicondylitis type symptoms in his left arm, so his non-dominant hand. You'll see, and this is what I found with him as far as what I think maybe provoking it, in addition to some of the daily stuff he was doing, but just kind of where they put the wrist with the dumbbell. They tend to always put it in like an awkward position, which may lead to some of the instability of the pressing too. So you'll see people who kind of press with a little bit more flexed wrist, really, really extended wrist in the dumbbell. They just don't feel comfortable holding a dumbbell kind of in a neutral position, which can lead to some other problems as well too. So that just kind of tip of my mind right now, just because of a client that kind of came in with those symptoms, and clearing up some of it just through treatment, obviously, but the more we can reduce the stress that happens with his workout in the gym, the better as well too. Shoulder wise, so getting into joint assessment, things like that, what you got on tap for that, Eric?
All right, so if you break it down, what are the prerequisite needs as far as mobility goes for bench press? You need at least some, I would say this is the least important, but you need some thoracic extension mobility is one. Number two, shoulder extension. And number three is shoulder internal rotation. So isolating those out, it's pretty easy to nail. When people start getting pain up here, I would say 95% of the time, especially like your CrossFit athletes, powerlifters, they'll be like, yeah, it hurts right here when I do push-ups, dips, bench press. And so you'll just break down, are they lacking? And almost always it's at least one or multiple. They have poor thoracic, poor shoulder extension, or poor internal rotation. And the worst part of it is when you do a bench press, you're combining all three. So if you lack 25% of each, then you're really going to struggle.
Yeah, that's a simple way of kind of looking at it. I mean, and this is where it kind of gets into treating, a lot of different patients that you see too, is the limitations that you see with someone who struggles with a bench press is a limitation you're going to find with a lot of general population too. So we'll break some of these things out a little bit further. Kara, Lydia, if you got any questions that comes up as we start talking about it, type it in the chat, let us know, or you can unmute yourself and come on and ask a question. Feel free to interrupt us too. Otherwise, we'll just kind of keep talking. But yeah, so let's, is there a certain one that you break out first, or do you look at them all at the same time? What do you do, Eric?
Usually I'll go to, I don't know, I just do them all. It doesn't really matter. I'll usually do thoracic first, just because I always go to thoracic first. Start more broad and then start to go into it. So thoracic lumbar locked rotation is typically my go-to. Again, I think with the bench press, you can get away with a lot less thoracic mobility than you can shoulder extension and internal rotation. So I'll kind of go first towards thoracic, see what their mobility is like. I'll have them do, it would be SFMA style, where when the active shoulder extension and then active shoulder internal rotation, and then take them through passive on each.
Okay. Passive meaning on the table, or passive doing the functional reaches?
I would do, I guess the first thing would be the functional reach, internal behind the back, but then I'll have them prone on the table, have them try to extend their shoulder. Actively, can they do it? And then if the answer is no, then passively I'll try to bring them through that range of motion. So I feel like it's rare for somebody to have this. What's up?
Go ahead. I think you're breaking up a little bit there, Eric.
Oh, my connection.
Yeah. Keep talking. You'll come on back some point in time. But so the breakout with shoulder extension, obviously, medial rotation, reaching behind the back, requires some extension. Now, if you're just checking shoulder internal rotation on the table at, say, 90 degrees abduction, you just need to be able to extend the shoulder to kind of a neutral position, and that's more horizontal abduction. For reaching behind your back, there's a component of shoulder extension that goes on. And I think this is kind of where you were alluding to before things started cutting out. But if you get someone prone on the table and you check their active extension, how far can they raise up? And then see if there's a difference between active and passive. Simple way to check if they have enough shoulder extension to be able to bench press is make sure you stabilize the scap, kind of posteriorly tilt it a little bit. Because what you don't want is them diving into an extreme amount of anterior tip with shoulder extension. You want to just see how much true shoulder extension they have. So kind of holding the scap back into a posterior tilt and then passively taking the arm back. And then simple thing is if you bend the elbow after they get back to full extension. So I'm laying on the table, you got my scap stabilized, posteriorly tilting, and then you extend back and then you bend the elbow. You should see that the elbow pretty much touches the table right at their sternum. And that's a simple way of kind of checking to see how much shoulder extension you need to be able to bench press, essentially. Also no pain, obviously, with that too, or any type of compensatory action, but being prone on the table, using your hand as a stabilizer helps you check that simply. And as opposed to getting a goniometer out, if you just bend the elbow and look to see where the hand's at, then it gives you a pretty simple indication of where they're at.
Yeah, sorry I cut out there. Another really good functional way to do this is it's a very gross, like looking at a bunch of things at once. Have them lay prone, face down on the floor. Can they go back and press backwards like that? And can you hold like 2 fingers underneath of their fists and they have that much space between the floor and their fists for a period of 10 seconds without compensation? So if they can't even, and it's pretty common, you'll have people that can't even lift their fist off of the floor. So then how do you expect them to correctly get in a position, bring the barbell all the way to their chest?
So you're just saying prone laying, so their hands are on the ground, and then they lift their hands off the ground?
Yeah, in a fist. So they're essentially bench press position. They have to retract, keeping good form, and lift. If they cannot lift off, and actually, honestly, I have trouble even lifting off because I know my mobility sucks. So it's challenging. And then if you have to be able to hold and maintain that for 10 seconds.
Okay. Yeah, I hadn't seen that before. That's a
very large. Yeah. So, I mean, if they can easily clear that, they can comfortably sit there with no problem, then it clears quite a bit.
Yeah. So you're talking just, you're laying prone, my fists are on the ground, and then you're just retracting back off of that. Okay. Do you see anything funky happening with the shoulder blades at that? With like them, you probably see this quite a bit, them just diving into an anterior tilt at that point in time?
Yep. Yeah. That's what I do. I just compensate and just tilt. So yeah, then they successfully perform the test incorrectly. So now you need to tease out why, like you had mentioned, internal rotation, extension, what's going on.
Okay.
This is another tangent off here real quick. This is pretty common. I've seen people have pain with bench pressing and they'll say it's in the front of their shoulder. They then do not have pain with like a barbell or incline bench press, which is really interesting because you would think that it requires more shoulder the further up incline you go, hence like a shoulder press straight vertical. A lot of times with that, you actually have less shoulder extension requirement when you're at an incline. So removing that component of it takes away pain. So I experienced that myself, and then a lot of people will report that. So if you hear somebody say that, it's actually pretty common, and then it kind of tells you that it may be some of that extension that is taken off of there.
Yeah, well, I mean, someone who goes to the gym a lot probably, I mean, they mess around with a bunch of different things to see what hurts, what doesn't hurt. So they usually find those type of findings. You just got to ask them, and they'll tell you. But I mean, that's some modifications that a lot of people do is you just remove the provocative factor and you start performing something else. So like you said, incline press tends to be one that sometimes can be okay. Other times it's a bad idea too. But like decline bench, you always hear people go into that all the time just because decline, you don't have to go through as much shoulder range of motion, brings the chest up to you too. So you don't have to go through as much shoulder extension. So a lot of times that's more comfortable for people as well.
Yeah.
Do you ever work that as like a corrective? So say this is just a power lifter again, and they need to get back to bench pressing. Obviously, the powerlifting setup's a lot different than someone just regularly doing a bench press because you're going to try to arch as much as you can. But do you ever use like a progression of decline benching, just back to flat benching at any point in time? That's the rehab. Obviously, you can be doing other things, manual therapy, other exercises too, but something simple as loading, finding the amount of decline that you need to take away symptoms, and then just start taking them back to a flat surface.
I haven't done that. I've altered. I've done very similar. I like where you're going with this. I've done like floor press, which takes away complete shoulder extension, and then slowly work them up in elevation to where they gradually have an increased amount of shoulder extension. So I've done similar, just in a different method.
Have you ever found that? So this is something that I've found in a few cases, and including myself too. If you go to floor presses, it actually increases your symptoms.
I've had some people that it does that.
Yeah. I'm not sure why. My assumption would be you're going from a standstill, so there's a lot of force that you have to create from, may not be completely extended like a bench press, but you're still at the bottom position, and then you got to go from a standstill. So that, I guess it's the concentric portion that you would say is implicated there.
Yeah, okay, so I'll ask people about that. It's very similar to if somebody does a squat, the highest degree of stress on the patellofemoral joint is at 90 degrees. So you'll actually have people that feel better going full depth because then they go through that and they aren't having like that amortization phase where they have to switch from eccentric to concentric. And then it's highly loaded where they're switching. Same thing with the bench press. If that is a lot of tension there and that's a painful spot, then yeah, you're basically, that is where you're redirecting the weight where it's most painful.
Okay. So similar to squat, like a lot of the heavy, slow, eccentrics, things that we've talked about in the past, applying that to the bench press, you could manipulate some of those variables then. So you do a squat, you do like a heavy, slow, or pause at the bottom position of the squat, and you find whatever load that you can start performing within reason as far as discomfort levels go. So would you do the same thing as a bench press, just kind of find the load that doesn't cause any type of issue, and then have them go slowly through it, pause at the bottom position, whatever amount of extension that you deem effective for that person, and then kind of build that back up?
Yeah, the two variables that you're dealing with are load, so how much weight, and range of motion. Yeah. Those two. You can alter those two. So what is the best range of motion that they can go through effectively and in proper form? And what is the heaviest load, reasonably heaviest, obviously not 1 rep max, but what is the heaviest reasonable load they can tolerate? Have them go through, because ideally you want to attain full range of motion. So what is the heaviest weight that they can go through effectively with their full, quote unquote, proper range of motion? And then start to build up from there.
Right.
Keeping in mind.
So some things, as opposed to the floor press, which there's that isometric that's involved with it. I guess you could get kind of bouncy at the bottom of a floor press where you kind of use the ground to kind of bounce your elbows back up. But I like a board press more so, just because that limits the range of motion there. But then it's still, it's essentially your chest, so you can still get your amortization phase with that. So you still have to use a barbell. So the barbell, that's a component too that you could talk about, is how much internal or external or hand position with the dumbbell makes sense for the individual to take away some of their symptoms, whether they're more neutral grips, pronated. Barbell, you have to obviously be pronated, but the floor press, the board press could be useful in that type of scenario. Also, something I was thinking about too with that, getting rid of or assisting with the amortization phase. So the bottom position of the bench press, pressing up, you could have, if you had a squat rack, you could put a band in the pull-up position, pull-up kind of attaching down to the bars, so it gives some assistance on the way up. But at the top positions where the higher you get up into your press, the more loading that is going on. The lower down into the press, the less loading that is going on, using those bands as an assistance. So that's an option as well too for people. Agreed.
I'll go into real quick. Okay, this is a common one. I'm not intending to pick on females by any means because plenty of males do this. It's just more commonly seen in females. I know they're gonna get mad. So so a lot of times with push-ups, you'll see that that shoulder flare, that elbow flare out. So they're going into a greater amount of abduction. So they're pressing more like this as opposed to tucking the elbows down. So this is based off of like a lot of your power lifters, but the kind of the mechanics of it apply to everyone and general shoulder health. Ideally, just like with a squat, just like with a bench press, the more muscles that you can tighten, aka like a lot of times your lats and everything back there, the more stable your shoulder will be and the better pressing position you'll be in. So in essence, with if there's a barbell on your back, it is trying to bring your lats to your pockets, trying to break the bar over your back. Will tighten like thoracolumbar fascia and everything. Just like that with the barbell, you try to externally rotate, breaking the bar in half, and it will bring then your lats to your pockets, which creates like a tighter shoulder position. So it ideally will then bring your elbows down and put you in a better pressing position.
You don't do that, do you, Lydia?
Dude, I know.
Just play.
I have a terrible bench. Okay, we don't even want to talk about it.
Yeah, kind of going off of that though. So I like the idea of creating more tension. I do that with a ton of people. It does backfire sometimes though. So in particular, kind of the cue that you were giving, kind of getting your lats involved. If you see someone with a really, really down sloped shoulder already, so their lats are probably already on a lot, and their shoulders are, there's a decent amount of slope to it too. Their clavicles are pretty much flat. They're already in that down and back position. Sometimes if you tell them to go further, that can create some of their symptoms to kind of come on too. So not necessarily perfect for every application, but it does work good for a lot of people too. Shoot, what was I going to say? There's another thing I was going to bring up with that.
And technically they would say.
What's up?
I was going to say, technically you would say for best like transmission of force, you need your forearms to be perpendicular to the ground. So, I mean, if you have a really wide grip and you're really cranking down on your lats, your forearms are going to be angled like this. So grip width, as far as then you are over tightening your lats or your grip is too wide. So you need your elbows to be perpendicular, or your forearm, shank of your forearm to be perpendicular to the floor with your pressing. So if you're cranking down, then you're getting kind of torquing the elbow in the wrong way too. So yeah, it varies on everybody, but keep in mind you want perpendicular forearm to the floor.
Yeah. So that's kind of what I wanted to go into, the setup. So you obviously have some experience with the powerlifting background there. What would be something different that you do for powerlifting, but then also general clients, or just how are you cueing someone to set up for a bench press?
It's a little bit different for powerlifting because you're trying to move weight. So obviously that's where you'll see that huge arch in your back, which isn't always the best. But you want your 5 points of contact, both feet, both shoulders, and the head. So whether you're doing powerlifting or not, you need 5 points of contact. And then you can go into from there as far as like squeezing the shoulder blades down a little bit, keeping the stomach tight. I don't know how. Yeah. I don't.
So, I mean, bar width. You obviously go away from the knurlings. I mean, that's a general rule of thumb just for anybody who's starting up with that. But do you find some utility going wider, narrower with someone who's dealing with shoulder issues? Or is that just more, I guess, yeah. Do you find any use or utility of going wider, narrower with your grip width based upon shoulder pain presentations?
Yeah, usually your more narrow grip is going to be better. You're bringing a little bit more tricep. Again, you're not bringing as much. It's much harder to go into internal rotation when you're like way up here. It puts a more provocative position. Essentially, if you added horizontal adduction, you're just doing the Hawkins-Kennedy test for impingement. So bringing the grip a little bit more narrow allows you to tuck the elbows more comfortably, and it puts the shoulder in a better position. But it's very similar to the squat, where you may have somebody do quad rocking to figure out what the optimal width of their feet is. You can look at, and anatomically, I don't know a good way to do this, but anatomically, you can look at somebody and say, okay, their grip is a bit wide. You need to alter that and then adjust accordingly. Right. But yeah, usually more narrow.
Okay. And then cues, are you cueing, how would you cue a posterior tilt of the scapula with the setup to the bench?
Driving your shoulders, driving your back into the bench is usually a pretty decent one. If you start saying things with the shoulder blades like squeeze together and down and all these motions, it gets tough for them to visualize that. So like pushing your back into the bench is one I use. Not always the best. It depends. Do you have any in particular that you found?
No, same thing you said, drive your upper back into the bench. Sometimes I even will allow them to, so again, a powerlifting, you're going to push your sternum towards the chest, so you'll kind of spread your chest out proud. You're going to try to drive yourself up into extension to try to move weight. So taking this back to like a general client where maybe you don't want to go into that much extension, but you allow them to kind of feel what that's like so they can get a little bit of a posterior tilt with it. And then you start taking away variables. So then you start saying, you know, not allowing their sternum to kind of go so far up or flare the ribs, and they're just getting it at the shoulder, but at least they kind of understand more of the movement that you're going for. So sometimes you can actually utilize different positions of the body to help teach them. I mean, down and back, shoulders back into the bench, those are things that usually work best. The other thing too is things that work on posterior tilting of the scapula. So if you get good at coaching a Y prone on table, or like a wall slide with a lift off, something that teaches posterior tilting of the scapula, and you do that well, then they can kind of take it back to the bench and kind of apply those same concepts too.
I've actually had people lay on the bench and do like a row, a banded row where the band is up above on like if there's like a pull-up bar. They actually will do it. It's almost like a pull down. You are teaching them how to retract. They don't know like, hey, I'm retracting or whatever it may be, but they know that they're pulling down and back. It shows them what tightness in that position, retracted position, feels like, and then maybe they can replicate that when they're bench pressing.
Yeah, I've seen that too. That works. That does work well. Dumbbell wise, or anything else with the assessment part that you like looking at, or we kind of covered some of that?
That's the main part.
Yeah.
I feel like the other thing, okay, so the other thing is, this might go down a little bit of a rabbit hole, and this is just my opinion. You can obviously disagree. If you find somebody that has pain back there and they have pretty good mobility, sometimes I think you're going to get where their posterior cuff, which is responsible for keeping that humeral head down and back, if their posterior cuff, mainly infraspinatus, isn't firing or doing exactly what it should, you get that anterior and superior translation of the humeral head, and then you're smashing that biceps tendon and supraspinatus. So if you have somebody that has good mobility, it could just be that their shoulder stability, their cuff is not firing appropriately. Not as common.
Right.
Not nearly as common in the push-up position per se.
I mean, you'd see the person, you'd probably see that person being shaky with the bar anyways, or shaky with the dumbbells anyways, more than likely.
Yeah, it's not as common as like overhead. If you have somebody overhead and then you have more of where it's like an unstable quote unquote shoulder. But sometimes you will find if they have pain, and I'll do this a lot, pain in the front of the shoulder, you'll feel the infraspinatus, and that thing is bandy and tight, and they will report that it hurts like hell with palpation. They don't have like active pain there, but if you palpate, it is very painful. So then if it comes to like manual therapy for anterior shoulder pain, sometimes I'll actually needle and work on that infraspinatus, even though it's on the opposite side of the shoulder.
Right. Anything that you work manual therapy to improve, so extension, shoulder extension, or horizontal abduction would probably be the two main ones, working anterior shoulder. Maybe like the clavicle even a little bit too, with those type of things to improve tissue extensibility, whatever you want to call it.
Yeah, I don't have anything special with that. Similar to like, I know that you do like some cupping, manual, whatever it may be, through like pec, anterior delt, just through those general structures. Again, I'm not thinking that that's going to make them have the best mobility on earth, but if it makes shoulder extension more comfortable, and then you can give them things to work on true mobility, that's more the manual therapy I'll go to. If their shoulder is super hot, then I'll do like needling, posterior cuff, anterior. Yeah. I found kind of working through the clavicle to be like the clavicular head of the pec, to be useful for horizontal
abduction. Sometimes you have to, if they're really, like you said, if they're really, really hot, if you put them into just kind of shoulder flexion, you support them there, and then you kind of work through it so that the tissue is kind of in a slacked position. That's probably the easiest place to start. But as they get more comfortable, you can kind of start taking them through more range of motion with that, maybe even like a pin and stretch type technique, and kind of working through that whole clavicular head portion. So I found that useful as well too.
That's why I call to ask you questions, Greg.
You got more answers with this one than me.
Just because my shoulder sucks. But yeah, no, same approach as you would be on that. Yeah, just a little bit of manual in the front to trying to get them more comfortable in that extended and internally rotated position.
Okay. Yeah, I think that's pretty good for today. If anybody's got any questions, feel free to put them down now. If not, no worries. We'll come back at you next time with a new topic. As always, feel free to, if nobody's got any further questions, we'll, always feel free to post in the Facebook group, post a question on the forum on SRE website, just so we have them ahead of time. We can get to them. We'll answer them. Just more questions we can answer for you guys, the better. And we'll keep continuing our talks next week with something else on the shoulder. And until then, we'll see you then.